Clinical nurse coordinators are the secret sauce at Riverside Community Hospital. We added them in October of 2020, and since that time they've accomplished many of the goals that we set for them. One is that they're a great help to all of the staff on the units. They're an available resource. The staff can turn to them, and they create a safety net for all of those new learners that we have in our hospital units, from new grads to new experienced nurses to Riverside. This clinical nurse coordinator role, what made you, Tina, decide to go for CNC?
Well, I wanted to grow as a nurse. I wanted to, grow and be a leader. I feel to be a good leader, you have to wear many hats, and I feel like I'm pretty good at juggling that. It's the times nowadays. Nursing's hard. The patients are harder. The hospital's busy, and you really need someone that can be strong, that can be on both sides, be an administrator, be a leader, and be a bedside nurse, and be that support system for the nurses, because it's really tough.
I agree with the support system. I had great examples of wonderful CNCs on my units, and I felt that I did possess a lot of those leadership skills. I've always seen myself in a leadership position. I was just a little worried to lose my bedside skills, so that's why I put it off as long as I did. But I feel that I am approachable. I am really good at certain skills. They come to me for difficult IV insertions. They come to me when they have situations with family members. I'm pretty good at communication and de-escalating situations before they get out of hand. But I think what I like most about it is just the support system that I can provide for the nurses. For me personally, I remember when I first started my nursing career here, it was charge nurse back then, not CNC. They were able to be pulled into staffing. So when that would happen, it would make it really difficult because you don't have that support system anymore. It's a lot to juggle having an assignment and then still trying to take care of your charge nurse duties. I think that is probably one of the biggest benefits of having like an actual CNC, is that you always have that support system there, no matter what. Not only that, but I think because we assist with some of the administrative duties, it kind of helps you see things, both perspectives, and it just helps you be a more roundabout, better leader.
Same, like touching on what Adriana just said, seeing the bigger picture. As we're kind of like both administration being bedside, we're able to help bring it all together, and being able to present that to the nurses helps the flow of the hospital. We're able to, have them understand why we're decreasing the Foleys, why the bed alarms are so important. It's like we're able to paint the whole why, and then helping the hospital and everyone, be better. The patients get the care that they need, they're safer, infection rates are going down. You're really able to connect everything and just be able to present that. Sometimes when I come to the floor, the nurse's eyes light up. Oh my gosh, thank God it's you. It's neat that you're here with us today. And that really makes me feel that I'm doing a good job at being a leader. When we do our patient rounding, I've connected with so many patients, and I've cried with so many patients, and I really feel they're able to take that away with them and just feel they're being heard.
I think it's the same thing, especially because I go to different units. In the beginning, it was a little challenging to get out of my comfort zone and learn the different cultures of the units. But when nurses express to me that they like that I'm approachable, that they're able to come to me no matter what the question is, that is one example, is the feedback that I get from my staff.
A lot of new learners out there too.
There is a lot of new learners, and they're very nervous, and they want to take everything on their own and not ask for help. So for me, it's important to let them know that you are able to come and ask us for help.
I feel like you guys are the safety net, that they feel safe truly with you, and that you've got them covered, and that they can come to you. That's huge. That's huge. That's the difference between success in that transition and not. So I love that.
I keep going back and forth. I put off taking this position because it requires you to obtain your bachelor's within 2 years, and I wasn't quite ready for that. But now that I'm doing it and I'm able to still, take care of home life, come to work, and still have a little bit of like self-care time, I'm like, I can do this. So I might go back for my master's. I've always considered possibly getting into like education. That's one part of it, but I'm really enjoying the CNC role. And obviously I'm loyal to the hospital. I've been here for 8 years, my entire nursing career. So I might stick around and see, what there is for me in store. I don't know, management.
Yep.
I'm not sure.
I love it. How about you, Tina? What do you think for your future?
For my future, just definitely growing as a nurse leader, as a nurse, taking any opportunity I can, any challenges that are thrown at me, I would like to head on, let's do it. And definitely sticking with this company. This company has grown me a lot in the last couple of years. I've only been here for almost 4 years, but I've learned a lot. I love the direction this company's going. I love my CNC role, and I feel like it's just gonna get better from here.
Yeah, I think so too. I think you guys are both amazing. I really appreciate what you do. I'm super grateful that you are a part of RCH, and that I really do think you make a difference every day. You may not always remember that, but I think you do. And another side effect of our secret sauce CNCs is that our turnover in the leadership ranks have reduced. We actually have a waiting list of people that want to be CNCs and those that are wanting to promote into manager and then ultimately director. It's been a great pipeline of leaders for us here at Riverside Community Hospital, and one of the single best moves we've ever made is putting CNCs in place.